have a family history of breast cancer, but during an annual screening mammogram in July of 2021, radiologists found an 8 centimeter by 4.4 by 4 centimeter area of ductal carcinoma in situ. There had been no findings exactly 12 months prior on that mammogram. While I am a registered nurse, my specialty isn't in oncology, so I wasn't really sure what my diagnosis meant or what my treatment would involve. However, I'm very blessed to work at a hospital that has an oncology nurse navigator and an oncology social worker. Together, they were able to point me in some directions and were able to give me some resources that would help me educate myself. Also, as a nurse, I was able to understand some of that information, but the fact that I was able to understand it was also a curse because I knew exactly what was going to be happening, what possible side effects could be, and what that recovery was going to look like. So I would say that having my nursing knowledge was both a blessing and a curse. Being diagnosed with cancer will definitely change how I practice nursing care. I currently work in a level 2 trauma center, and while I'm no longer at the bedside, I am supporting our trauma survivors in the emotional aspects of their recovery. Having gone through the trauma of receiving a cancer diagnosis for myself, I let them know that that for me was the hardest part. I let them know that PTSD is normal and that it is expected, and it may not happen in the weeks following their injury. It may be months, it may even be years, and it can come out of nowhere. And so I teach them to just be patient with themselves, to be kind to themselves, to find their support system, and to ask for help when they need it.